Thank you.
The green button makes it green.
Good morning, everyone. Welcome to the Human Services meeting of June 26th. Could I please have a motion to accept the minutes of December 21st, 2021?
So moved.
Brian, do we have a second? Thanks, Kathy. Darrell? All in favor?
Aye.
Thank you. Going forward, we're going to go into public health. I think I saw Tina on here. Hi, Tina. Good morning.
Hi, good morning, everyone. The first thing I have is to carry over some grant money from the 2021 year into 2022. I do have a stack of them. The first one is our early intervention administrative grant to carry over the unspent funds. It's $9,976. I'm not sure, do you want to do these individually or do you want me to just go through them and how do you want to do that?
Individually.
The committee can do whatever they want. There'll be separate resolutions.
Okay.
Yeah, bring them all to once because.
Yeah. Go ahead, bring them.
Just move it on the finance anyway. Yeah.
Okay. So we'll do them all, Tina, and then we'll move into finance.
Okay. All right. So that was the first one, the early intervention. The next one is the funding that we received for the schools for COVID. It's the Elc School Funding. The amount to carry over is $1,513,343 to carry over into 2022. The next one is related to the fellowship program, the money that we received or will receive for our fellowship program, which is still in the works right now and being organized. And I've been working with personnel on that. We do have a meeting with the state at some point next week to discuss that. And that's $980,000 to carry over into 2022. The next one is our COVID-19 vaccine response grant. The amount on that one to carry over is $167,293. The next one is our regular public health preparedness grant that we've had for quite a few years now, and the amount to carry over on that one is $16,893. The next one is another COVID grant. It's the COVID enhanced detection grant, and that one is $110,867 to carry over. The next is our child passenger safety grant. It's a recurring grant that we get each year. The amount to carry over on that one is the full amount of the grant, the $15,000. And the next one is we do this each year. It's the money that's related to the district program. And that one is $87,276. And I believe that is the last one.
That's a substantial list. So,
Yes.
so Brian, did you move that?
I'll second. Yeah, I'll
Thank you,
second.
Darrell. Thank you. All in favor?
Aye.
Okay.
I do have a question, Madam Chair.
Yeah, go ahead.
So it's going to be a combination of Tina and probably Brian Campbell. So as an example, we've got some significant numbers there for a couple of them. One of them, or actually several of them, are kind of COVID related. Do we expect that we'll be expending those carryovers? And if not, what do you do if they're earmarked for that particular purpose? What do we return it to the state, or is there a way to transfer and repurpose, or are we just kind of gotta wait and see what this thing unfolds? Thank you.
Yep, we do anticipate spending. The amounts have been budgeted for particular purposes within there, either for, well, a lot of it has to do with our COVID response, but there's also for testing and for our vaccination clinics. So we do anticipate spending those amounts. But again, we only get reimbursed what we spend. So the rest of the money does go, it just goes unspent, and it goes back to the state. So it is a reimbursable grant. We only are reimbursed, and it's not something that we could repurpose it. There's very specific criteria that goes into the grants, and they have to be spent on very specific purpose. So it's not money that could be repurposed somewhere else.
Thank you.
Mm-hmm.
Any other questions, Tina?
Okay, the second item has to do, I just wanted to give you a quick staffing update. We have reduced our staff quite a bit over here with the state taking over the case investigations and, no longer doing the contact tracing. We have reduced our staff significantly, and we did let go a lot of those people that we had brought on for COVID. Everybody was great. We were sad to see them go, but, with the state taking over that piece of it, we really didn't have anything for them. So we have, reduced our staff. So I just wanted to give you an update on that. So that's really all I had for the staffing update. We do have some retirements coming up, and the advertisements are out there. We've had just a couple applicants. So we're hoping, that those will continue to come in. And then I do have a couple things under miscellaneous. I know that Tim had put out the information on the testing site. So that will be up and running tomorrow from 9 to 3, and it'll be on Tuesdays and Thursdays over at the Burgoyne site. It is a PCR test, and it's through the Quadrant Biosciences. So we will be over there doing that again on Tuesdays and Thursdays, and we're only going to do it for a couple weeks to see what the interest is there or the need. So it's not something that'll be ongoing, if there's not a need there. So just wanted to give you information on that. We do still have quite a few clinics set up. I know that, they're out on the county website of where they are and what we'll be offering. We're going to try to be offering all of the available vaccine to all available age groups at this point. So we can try to get as many people vaccinated, as possible that wish to be vaccinated. So those are out on our website. I did want to talk just a little bit about the state budget. We did get some information from our NICE-HO, our state organization. Some good things for public health in the state budget. Hoping that it does go through. It does increase our base grant for our Article 6 funding. Right now we get $500,000. There is a proposal in there to increase that to $577,000 for partial service counties, which would definitely benefit us, as well as reimbursing us for fringe benefits. Fringe benefits have never been eligible for Article 6 reimbursement. So there is a proposal in there as well to reimburse us for fringe benefit expenses, which would be very helpful for us. There's also, at the end of the year, the governor had signed a regulation or law that says that early intervention services would be covered by third-party insurance. So there is a proposal in there that if for some reason the insurance does not cover it, right now it does come out of our escrow account for the county to cover those costs. We would be reimbursed through the state for those costs that should have been covered under insurance. So that's also in the proposed budget going forward. So we're hopeful that that'll go through as well. And that's pretty much all I have, unless anyone has questions for me.
Brian?
So on the governor's budget, there's things that we should be lobbying to make sure they stay in. Is there anything we should be trying to get out? I guess that's the bigger question.
No, the one thing that would affect us negatively, I guess, there is a proposal in there for the preschool providers to get a COLA increase in the rates that they're paid of 11%. So that would affect us here significantly. We do get Medicaid reimbursement on that, as well as 59.5% back. So, we haven't had a chance here, or they haven't sent us anything to say like, how, exactly how that would affect us money-wise. We just haven't had a chance here to dig into that to see. But that's the only thing that I could see in there, and that's the only thing that NYCHO would send to us that would really be a cost to the county. The other items in there, like I mentioned before, are positive for public health.
And I missed, what providers were those?
Preschool.
Preschool, okay. The only thing is, if they actually had that increase, you have more opportunities? Would there be more people available, or is that not an issue anyway?
Right now, we're okay with preschool providers. It could be a good thing for them to get that increase and be able to recruit more people there. Like I said, we do get Medicaid. We do get some reimbursement on it. We get Medicaid reimbursement, and we get the 59.5% as well. So until we kind of dig into that a little more to see what the effect is, I can't really say at this point.
Okay, thank you.
Sure.
Any other questions for Tina? Dana?
Tina, the PCR test is happening at the Burgoyne campus. Is there any kind of a criteria or filter as to who is eligible to go there? I'm worried that, if you have asymptomatic people that are worried and concerned and they want to test, that they could be 50% of the tests done, and we could run out before people that maybe have a common cold or the flu who want to see, is it COVID or is it the cold? That is where our assets should go, not to people that are worried or concerned. Can you comment on that?
Right now, there is no criteria. There's a scheduling software with a link out on our website where somebody can register for that. The testing has been going down in our area. So, I don't think that there's going to be a big push for testing at the site, but that's why we're going to try it for a couple of weeks and see how it is. It is, like I said, it is a PCR test. When you go on to register, there's also, your insurance will be billed for it. There is no out-of-pocket expense. So if you don't have insurance, you can also, you can come there and, like I said, there'll be no out-of-pocket expense. The company that does the testing has a way to get that reimbursement from a program through the federal government for the testing. But right now, there is no criteria versus symptomatic versus asymptomatic people.
If
you
do not anticipate a large push, why are we doing this?
Well, we want to see. I mean, we had the opportunity to do this probably 4 weeks ago. But at that point, we didn't have the staffing to be able to do it because we were still doing the case investigations and the contact tracing at that point. So we really want to try this for the community and see. I know the link just went out. I don't know if Tim put it out last night or first thing this morning, and we already have people registered to come in to test. So it's really, we're going to just try it for a couple of weeks and see. We're obviously not going to continue it if there is not a significant need for it in our area.
Isn't this available at CVS pharmacies locally?
It is, but what we had been hearing was that there was quite a wait for people to get in to get tested. So again, but we have heard recently, even from our Cambridge Valley, they've been doing testing as well, that the numbers have dropped off recently. So
one final question, can you tell me what is our capacity? How many tests are we able to do?
We can do, I don't know if Tim's on the call. We had set up, we're going to have 1 to 2 people over there to help with the testing. The person does their own test and they're scheduled in 10-minute increments. And I believe it's set up for 2 people to be able to come in every 10 minutes. And that's through 9 to 3. So
when will you run out? When will you run out of testing material? How many tests?
Quadrant supplies those tests. So they're going to be bringing those, they supply those test kits to us. So they will have enough for the number of scheduled appointments that could come in for that day. They have not said that there's been an issue with them getting test kits. They do the testing out at the schools as well. All of the schools have those test kits, and there has not been a shortage of those kits.
We're not buying the test kit.
No, we're not.
Right.
Okay.
They're providing the kits, we're providing the body.
Okay, so it's theoretically unlimited.
You're right.
At this point, yes. There has
Thank you.
been no shortage. Sure.
Thank you.
Thank you.
We've had some amazing surprises in early intervention in the past decade or so. Is this going to have some kind of really positive financial impact? What do you think the impact of the changes are going to be?
Yeah, this was a huge success for early intervention. They've been pushing for this for a while. And the governor had till the end of the year to sign it. And she did sign it at the end of the year for it to go through. So it's called a covered lives assessment is what it is. So the insurance companies are supposed to be covering this, but in the instance that they don't, she did put that in her budget for us to get reimbursed out of escrow. Right, we would still have to pay it out of escrow to the providers, but then the state would then reimburse it to us. So it'll be significant for us.
Any estimate on what we might get out of it, or is it too early?
I'd have to take a look at that and see. We'd have to go through and see out of the people that we paid out of escrow who had insurance that could have paid. So we can definitely take a look at that and see, what we would have gotten reimbursed from the state if this had been in place before. We just haven't had a
Well, it's
chance
good
to do
news
that
anyway.
yet.
It's early intervention has been an albatross there for a number of years.
Yeah.
Any other questions for Tina? Tina, thank you very, very much. I would imagine if I came over to visit, it would be a quieter place over there, a little bit, maybe, just a little bit.
It is quiet. Yeah, the phone. I mean, yesterday the phone was a little bit crazy, but today it's definitely been quieter today. So.
Yeah. Oh, good. I'm glad. You need that, a little pullback. So thank you very much and thank all of your staff.
Thank you.
You're welcome. Okay, I think I saw Tammy on here. Tammy,
Yep.
Are you ready? Good morning.
Yes. Good morning. How are you?
I'm good, thanks.
Okay, first up, I wanted to share some of the highlights that have been focused on through the New York Public Welfare Association from the proposed executive budget. One of the things that seems to be getting a lot of attention through the state as far as social services are concerned is that the budget proposes to modernize the foster care maximum state aid rate. It is essentially what we are told how much we can pay foster parents for providing services. And the reason that the state is including this in the budget is because it's a settlement to a recent lawsuit that they had. So this change would mandate districts to pay 100% of the maximum state aid rate for children that are in regular therapeutic, special needs and emergency foster boarding homes. The state has indicated that they are not planning to cover the additional cost to increase the rate of foster care, and that they're only going to increase or cover the increase in adoption expenses. So while that would seem like a concern for us, and I would guess that might be something that the budget officer perhaps has seen or heard in any sort of NISAC information, it really isn't a problem for us because we already pay the maximum state aid rate. We actually stand to gain potentially more from this change if OCFS does pay more now towards adoption subsidies, because that has not been something that we've been paying the 100% of MSAR for adoption subsidies as well as foster care. So we should not be harmed from that. The majority of the budget changes that are proposed really aren't things that will harm us, but I do want to share with you that they have added in, or the proposal is to add in $62.5 million over what was in last year for childcare. They also plan to raise the eligibility level for people from what previously the highest level income that you could have was 200% of the federal poverty level. Now people can be eligible, it will be phased in over 3 years, up to 300% of the federal poverty level. Again, we have had the higher levels of eligibility on this, and we haven't ever in the last several years had enough demand in the county for childcare assistance to actually spend out the appropriations that we receive through the state. That is unfortunate. We've talked about that in the past. One of the biggest reasons for that is that there are not enough childcare centers or registered daycares in the county, as well as the fact that people have to be working and need daycare during the hours that it's available to be able to qualify for this. One of the things that we had been concerned about was the fact that the child welfare financing structure, which is set for 5 years, was up this year, and they are continuing to fund preventive services at the 62.38% rate for the next 5 years. So that just keeps it the same as it has been. The payments for Raise the Age are unchanged. The alignment for how schools and the county pay for Committee on Special Education placements when your local school districts are having to place children into residential facilities because they are no longer able to program for their needs educationally in any other way. The way that is funded has been set to stay the way that it had been over the last 2 years, which at that point had been a temporary modification. Essentially what that did at that time was shift more state costs to the schools. It did not impact the county on that, and they're proposing to keep that the same. One of our biggest funding streams has been, we call FFS, the Flex Fund for Family Services, and that is TANF money. That's continuing to be the same as last year. One of my concerns about that is it has stayed flat for the last several years. I would have to say that probably 10 years. And of course, the things that we pay for out of it have increased in their expense. So while they're not taking anything away from us, we are having to shuffle things differently to continue to pay for them. One thing that's mentioned in the budget, and I will get back to in a little bit, is that the transitional rent supplement is included in this at the $100 million level, which is the same as last year. Code Blue is being funded the same as last year. So that's another thing that we're mandated to provide. And so with that, this funding will continue to cover that 100%. NISAC actually releases a county impact scorecard, and this next one is a thumbs down on the scorecard by NISAC. So they are anticipating this to be a cost statewide. It is a public assistance program change where they're requiring us to determine safety net assistance applications within 30 days, which is consistent with how we do the rest of our applications. However, Safety Net has in the past had a 45-day wait period, which is a diversionary measure to encourage people to become employed or self-sufficient without having to go on to the eligibility program and receiving those funds. I have not yet been able to totally wrap my arms around all of the additional language that is proposed with this, and give an attempt to come up with what the local impact would be for us. I am hoping to get more information. I am in the middle of the New York Public Welfare Association conference, and actually just it's winding down this week. And as the commissioners will be meeting with the state agencies, I hope for us to get more information on that. But the thing that I have learned over the years is at this point, it's proposed by the governor state. It certainly can change before it actually is adopted. Another thing that's proposed is a $25 billion housing plan. There's nothing written in there that makes me, gives me any answers as to how that plans to roll out. My concern would be that it might end up having some component be a program that is pushed down to social services to administer, as we have seen with some of the other federal funds that have come through over the last year or two. And that stretches us and our ability to perform our functions. With the Department of Health, the state Medicaid takeover apparently is still on their agenda, and they're looking to, the state is absorbing any of the Medicaid, local Medicaid growth expenses, which is better than in the past. There have been times that we were worried that we were going to get shifted more expense. So this is, I guess, a win. The Medicaid admin cap will not have any changes either. So that means that our Medicaid staff are fully funded at 100% through the Medicaid cap. Portions of our other expenses of, for instance, occupying the space here in the building would be covered under that funding as well. And then where I would anticipate having a question from the budget officer would be about the component of the budget that says that the EFMAP extension will continue, with the federal government extending the public health emergency through June 30th of 22. The provisions with the EFMAP will continue to be authorized. I cannot speak any more in depth as to what that means for us, other than at some point we're supposed to benefit financially with it. Is there any questions related to the budget information I've just blown through?
No, I think you're right, Tammy, and of course it all comes out with what they actually pass in the end. That's the problem. If there's just something that we need to fight to get out is what I really need to know. It's hard to get other things in, and if there's something we really need to make sure that comes in, we need to fight for that too. So, you know, if there's anything that comes up on your radar, I need to hear about it, the sooner the better, because we have direct links right now that we haven't had in the past that really help us in that level.
Okay. Yeah, I heard you ask Tina if she had any major concerns. I don't have right now any like big beacon of, you know, concern. I do still want to be able to better understand what's being proposed with the public assistance program changes. And I do remain concerned that something with that housing plan, while obviously we need affordable housing, you're never going to hear me say that we're all set on that. We do still have homeless people that we're keeping in housed in motels until they're able to find something suitable. I just worry about how the state may end up drafting some sort of a new plan and dropping that on the counties to administer.
And I know that Matt Simpson addressed this the other day with me, that he's actually met up with the woman that's a Democrat from one of the areas right in New York City, who's very close to the chair of that committee. And they've talked back and forth on what their differences are and how they want to get to understand them, because when they need a shelter for 2,000 people. When we need a shelter, it might be 20. And they seem to both be on the same page that, yeah, those discussions need to take place, because just like anything else, when the state passes something, it's blanket for everybody, and we need to make sure concerns both sides are, you know, met. So I should be able, he is on that committee also, so it should be very interesting to find out directly from him where some of that stuff is at.
Okay. It's one of the things when you look across the state, the state agency as it is considers homeless people as being in shelters. Statewide, that is not the case. Most counties upstate that do have shelters are still ending up using motels for their overflow, and many counties have no shelter whatsoever, not even one in their region. So it, you know, when the state passes something and tries to make it be a one size fits all, we do struggle with that, and I'll keep my eye on that. I don't see where we truly could stand up a shelter in Washington County, which probably comes as a relief to a lot of people because it would be a major undertaking to do anyway, but certainly our region needs to have them.
I'll bring it up with him because I think he can probably, and maybe I'll have to call you directly because I'm sure that he's going to be right in tune with that since he is on that committee.
Okay.
Any other questions for Tammy on any of this? Matt did say he would reach out, Tammy, so don't be surprised that if you get a phone call.
Okay, thank you.
You're welcome.
I heard Brian and I thought, oh gosh, I gotta be ready for that call.
Yeah, he said it's Brian and to me, so.
Yeah, well, it's always nice though to talk to the person that knows exactly what they're talking about. Since you are that person, I would rather have it talk to you than have me relay a message and mess it up.
Yeah, it was actually your call that I was concerned with fielding, Brian.
I don't even blame you.
Any other questions for Tammy? Okay, Tammy. Next.
I probably shouldn't have. I should have looked further down my agenda because now I actually need to ask for a resolution to move money into our 2022 budget. This is much like what public health just had, but I have just this one, moving funding that was associated with ERAP, the Emergency Rental Assistance Program. These are funds that we set aside to be able to draw down to cover our administrative costs of operating this program. So what we have left to move from 21 into 22 for this is $19,728.
Thank you. Brian, do we have a second? Cheryl and Kathy, thank you. All in favor?
Aye.
Aye.
Thank you.
Okay.
And the last thing that I have on the agenda is the rent supplemental plan. That's something that I have mentioned over the last couple of meetings. And it was funding that had been provided related to that 100 million set aside in last year's budget. So the state provided us with an opportunity to make a plan for a rental supplement to find a group of people that we would be able to provide extra funding to so that they could help afford their rents, with a lot of other qualifying factors being added in. One of my concerns was that this was going to be a one and done, that it wouldn't continue to receive funding. So the good news with this budget is we can see that that 100 million continues to be in there at this point. So it takes away that immediate concern. There's still an awful lot of work that the state assigned to the counties that is duplicative to programs we already have, and certainly would be something that each county has to do by the way it's being prescribed at this point. So I do still hope to get more information from my statewide colleagues on this, and hopefully we can share information and maybe just use some of the forms that some others use and adapt it for our purposes. So I'm still working on this. I still do not have a final plan that I want to say to you, this is what I want to submit. My focus right now, if I have to define a population, would be the people that we have the hardest time finding housing for once they become homeless. And that would include large families, any families that need more than a 2-bedroom apartment, ends up staying homeless longer because it's a much more difficult search to find apartments with more bedrooms that can, accommodate multiple children and different gendered children, and be something that is affordable for those families, as well as the single adults that have been recently released from incarceration. We have them longer in homelessness situations because of the restrictions that they have in place about where they can live, and just the other barriers that they would have, you would understand, with them having just been released from either jail or prison. So those would be the two areas that I would be looking to wrap in and then have that be a positive outcome for the county to reduce the amount of money that we're spending on motels. When I do draft that plan, I will need to submit it before our next meeting, but it is my submitting a plan saying this is how I want to do it. And I still would have to have multiple levels of approval and probably edits through the state process at that point. So I would be able to review that with you at the next committee meeting, and continue to keep you up to date moving forward. But I would like the support to be able to submit that plan.
Tammy, does anyone have any questions for Tammy on that? That's a big job ahead of you. Just separate those two that you just talked about, populations, and both of them are kind of their own set differences as far as need goes. And so are you looking for a motion from us so you can go forward?
I'm not sure. What do you believe I need? I do not think that this requires the chairman's signature to submit. I believe that it's similar to the other state plans that we receive, and it would just be something that I am able to submit. But usually when I do that, I'm letting you know what it is that I'm submitting. So this is $131,000 that we would then divide up as needed for people who are appropriately eligible for it moving forward. It would not be happening over the course. It would not be something that would go into effect in the next month or two, but I do have to submit in the middle of February.
Thank you, Tammy. I look back at like the White House and remember when that started, and we're talking about that and the homelessness for young teenagers in early 20s, and what a big lift that was. But look at the outcome that served for the community, and we all know how successful that has been. And so I can't, what you're going to attempt to do here is monumental. So thank you for pursuing it, in my opinion. Does anyone else have any other ideas on this for Tammy?
Madam Chair.
Darryl, go ahead.
No, I think Tammy is well within her area of responsibility there, and formulate a plan to properly go through all those steps in coordination with the state, so that we can do the right thing with the funds that are provided by the state.
Correctly. Thank you. Anyone else? Okay, Tammy, next.
That's it.
That's it. Thank you very, very much.
Thank you.
We'll talk again, right? Soon, probably. Okay, we're going on to Community Services Board, Mental Health. I saw Rob on here. Rob. Morning, Rob. How are you?
Good morning, everyone. Doing fine.
Great. Thank you.
All right. So I'll launch right into my agenda items here. First item is request to amend the 2021 Washington County budget. This is to clean up the budget line for the expenses, county expenses for the restoration of competency. And I think I've explained to committee members before, there's quite a lag in the billing on this. And there's a high degree of unpredictability in terms of the expense for the year. In 2021, Washington County did increase the amount they've been budgeting in this line to $100,000. And unfortunately, we still haven't received the November and December bills, although we are able to, at this point, since the year has finished, we were able to confirm, what those expenses will be, because we did have individuals hospitalized under this competency restoration at the end of the year. So the bottom line here is that there's a need to request a transfer of $83,500. So that would be the total expenses for the year would be the $100,000 that was budgeted plus $83,500, and that will cover the expenses that were incurred in 2021.
we have a motion for that? Brian? And Kathy second? Carol second? Any discussion? Go ahead, Brian.
So, Rob, this is something we can't pinpoint ever. So is the 100 the number we can leave and just transfer if we need, or is this something that needs a lot of extra added to it going forward?
Well, again, I would leave that up to the supervisors and committee members, budget committee, et cetera, to really determine whether it's better to leave it at 100 and then do the transfer as needed, because it does vary from year to year. So, you know, this year we could end up under the 100, although to tell you the truth, to give you just a year to date for 2022, one of the individuals that was in at the end of 2021 is still there. So that individual has incurred costs of $28,226 so far this year. So out of our 100,000 budgeted this year, we've already expended over 28,000. Now, you know, whether it's better to transfer from fund balance at the end of the year or, you know, beginning of the next year, or whether it's better to make it part of the levy, again, I just leave that up to the committee members.
Hey, thanks for sharing that with me. That's why I asked.
Yeah. And just for your information, I mean, it's only 3 individuals that can incur these kinds of costs. The per diem rate at the hospitalization is over $1,000 a day. We're only talking about 3 individuals, but it was, I forget the number here, but I think it was 165 days total of those individuals. So it adds up quickly.
Okay.
Yeah, Brian, I don't think we've ever had enough since I've been a supervisor. We've always transferred in. And I think that this is going to be a trend that continues to go up, because I think they're going to put people in to make sure they're right to stand trial, and there's going to be more of it.
Kind of where I'm at, but sometimes, you know, we've been lucky and we've got a lot of that money that never got spent, but I think the trend is the other way, just as you say.
Dan, did you have a question?
Yeah, I was going to say the same thing Jay said, so said and answered.
Thank you. Okay, so did we vote? Okay, so all in favor?
Aye.
Thank you. Okay, Rob, anything else?
Yes, I have an additional resolution request, this time to amend the 2022 Washington County budget. This would allow for acceptance and pass-through of $41,250. This is 100% state aid from the New York State Office of Substance Abuse for provision of jail-based transition release services. So I've had some discussion with Sheriff Murphy about the utilization of these funds, and we're in agreement on how these will be utilized within the jail for some transition release services. This assists inmates as they're being released from the facility to connect with appropriate services in the community.
Okay, do we have a motion to forward this to finance? Brian?
Second.
Okay, second, and Cassie is second. And Dan Shaw. Any questions for Rob on this? Okay, all in favor?
Aye.
Thank you. Okay, Rob? Thank
Okay,
you very much.
Last item, I just want to provide an update, informational update, and I've already talked to Melissa and Ken Wenchel on these, but I want to provide an update for the committee on the RFP that was issued for the Adirondack peer-to-peer program. This was an RFP issued by Warren County on behalf of both counties for this program. It was issued in November of last year with a return in December. We did receive responses from 3 outside entities. That would be SUNY Adirondack, the Adirondack Vets House in Glens Falls, and an agency called People USA that provides some peer-related services. So we have 3 responses to the RFP. We started to assemble a selection committee at the end of 2021 to review the RFP responses and make recommendations to the respective county committees and boards of supervisors for approval of a contract. However, we ran into a few delays in Warren County just in terms of the selection of those members because the RFP does specify appropriate elected officials. And due to the end of the year, it was determined that we would wait until the beginning of 2022 to have, there was a change in some leadership in Warren County, and it wasn't clear who the committee chairs were going to be. So we wanted to wait till that was all settled, and so that people could make decisions on who the appropriate elected officials from Warren County to be involved would be. And so I've had some communication now with the chair of the board there, Kevin Garrity, and the county administrator. I think we're ready to move forward now, and that we have that clarity. In Washington County, Chairman Hall had agreed that Chairwoman Clary from this committee would be part of that process. So thank you for that, and we'll be getting some information out to all the members of the selection committee and moving forward with that. I anticipate a recommendation or decision at least by within a month or so, and we'll run it back through committee and to the full board by the end of the first quarter, I believe.
Great news. Thank you.
Yep, and I did see in the, I don't really have an analysis of the executive budget for my department today. I usually rely on a memo that my statewide association puts together. But I did see in the information that the $185,000 for this program was included in the executive budget for Warren and Washington counties this year. Every year it's usually left out by the executive and is left as part of the negotiations for the budget. But this year it was included in the executive budget. And in fact, the governor included it, made it statewide, and so has included all the counties now, which wasn't the case prior.
Excellent. Thank you. Any other questions for Rob? Okay.
All right, thank you, everyone.
Thank you very much. Okay. Mike Ray.
Good morning, everyone.
Morning.
I just wanted to update you that, again, this year we had to cancel Winterfest due to COVID related, and I was remiss in not mentioning it last month, and I've received a few calls. They'll be added to our website. I also want to update the committee on, we have scheduled lifeguard trainings for this winter session is going to be February 21st through the 25th. It's Red Cross training. We're doing that at Hudson Falls Intermediate School, and it's free of charge. So if you have any youth in your community that may be interested looking for summer employment, or if you have existing staff that needs to update their training or be recertified, please have them contact our office and we'll schedule that. We plan on having another training in April, the week of 4/18 through 4/22. That'll be at the intermediate school, and that'll be focused on recertifications for county lifeguards and municipal lifeguards, as well as we're hoping to get a full training in that. So, and also if you have any summer recreation staff, any youth program staff that need first aid CPR, please don't hesitate to contact our office and we can do the Red Cross training there. As far as the state budget, YDP, which flows through OCFS, is flat, and the governor's budget for the same as last year. So I don't anticipate any changes in that. And I just want to lastly thank the committee and the board for the support on the merger with Warren County. We're going to be starting that process very soon. Contracts will be up to Roger for his review and then passed on to the chairman if everything is in line. And I'll keep you posted as we move forward. Thank you.
Thank you, Mike. Did anyone have any questions for Mike before we move on? Okay. So now we have Gina. Good morning, Gina.
Good morning, everyone. I do have 2 agenda items, and I'd also like to give an update to the committee following the agenda items. The first item on the agenda is the appointment and reappointment for Office for Aging Advisory Council members. I did submit a request to appoint Tina McDougall to the council, who's going to represent Washington County Public Health, as well as Val Baez of Granville and Julian Hadley, who will represent Cambridge.
Okay, do we have a motion to Kathy? Okay, and Brian seconds and Daryl seconds. All in favor?
Aye.
Thank you. Okay, Gina?
Thank you. The next item is an overnight travel request. Every year, well, with the exception during the pandemic for the last 2 years, the directors for Office for Aging across the state come together and do with a lot of strategic planning with the New York State Office for Aging executive staff. And at this time, they are proposing that this Leadership Institute take place on April 5th through April 7th of 2022. It does entail an overnight stay as well as a registration fee. At this particular time, the cost for the event is approximately $287. And I do have funds in my budget to cover this. And at this point, I'd like to ask the committee permission to attend this Leadership Institute.
So moved.
Thank you, Daryl. Kathy seconds. Thank you. Dan?
Yeah, I second it too, but I was just curious, where is it located at, Gina?
Thank you for asking. I didn't share that. It is in Clayton, New York,
Thank you.
up in St. Lawrence County.
Thank you. Okay, all in favor?
Aye.
Thank you very much. And what I'd like to share with the committee is an update on our unmet needs funding. As I requested in 2021, we received late in 2021 an allocation of $85,000 for unmet needs funds. This is 100% state funds. Due to the fact that we received it late in 2021, I did ask for a resolution to carry over the funds into the 2022 budget, and the board did agree to that resolution. At this time, given our current status of programs, we're estimating approximately $45,000 to $50,000 of that $85,000 to be in need of being spent. The program year for this funding source is March 31st. And at this particular time, we're scrambling to come up with a plan, a solid plan to address the unmet needs of our Washington County residents. So I did have a conversation with the state this morning, and they had suggested that I put in writing a request for a program extension. And at this time, that is my intent, is to make a formal request with the New York State Office for Aging to ask for a program extension, allowing us time to come up with a solid plan for the unmet needs funds, hoping that that extension lasts through September of 2022. A piece of that plan is the need to add in additional contractors for personal care services. The whole purpose behind unmet needs is to do just that, to address unmet needs of the Washington County residents. At this time, our department has a wait list for individuals in need of home care. The problem that we have is not so much financially supporting that, but the problem that we have is the agencies that we currently contract with just do not have the workforce to meet our request to service these individuals. So at this time, I would like to ask the committee's approval to send out a request for proposals for home care agencies and look for adding on additional home care agencies to our current subcontractor list in an attempt to find a workforce to address our wait list for personal care services.
That's a very good plan, Gina, because that's the question I get quite frequently at the town office is where can we find them and how can we find people to help us? And it's pretty hard on people. So
yes.
Thank you for attempting to fill this.
Okay,
do you
thank
need
you.
a motion?
Sue, I'll make a motion to move it.
Thank you, Paul. Do we have a
I'll second it. Yep.
Okay. Any questions for Gina on this issue? Okay. All in favor?
Aye.
Thank you. Thank you. Good job.
Okay. Thank you. And just to give everybody a brief update, we did allocate unmet needs funds to expand our senior transportation program. We have started that program in January this month, and right now we are under contract to serve only 10 individuals with the senior transportation program through GoGo. We've been able to fulfill that, and so most certainly I'll let you know as we get closer to this program year end in March and possibly look to expand that contract with GoGo to incorporate more individuals to utilize the program.
Wonderful. Great.
And at this time, that's all I have. Thank you. Unless
Thanks
there are
very,
any
very
questions.
much.
Thank you.
Wonderful. I see Ken on here. Ken, did you want to add anything?
I don't have anything to add at this time. I appreciate it.
Okay. Any other business to come before the board? Bob?
Just a comment. You know, we've over the past, I don't know, probably 10 years or so have dropped our lances and charged several windmills. One was the mortgage tax and the other was the Black River business, which looks like we might have solved. Perhaps our next one ought to be this competency business that is going to cost us another $83,000 unexpectedly. That's always been something that has been a completely unfunded and dropped upon us state mandate, and it is a state facility. It seems like they ought to be covering the cost for that, not the counties. So that might make another good Don Quixote attack here in the next few years.
Go ahead, Rob.
Yes, I believe our statewide association, the Conference of Local Mental Hygiene Directors, is advocating for changes to that, either for the state to support the costs or for a return to the previous arrangement where it was at least the state supported half of the costs. But I can keep the committee informed of any advocacy that's going on either by our statewide association, or I believe there's also some advocacy through NISAC.
Yeah, I know there are others involved. It's just, it's such a completely unpredictable and rather large ticket item. It can do some real damage to a county budget, especially not in good years.
Yeah, and our numbers are very small, only 3 individuals. Imagine larger counties are also impacted with larger numbers and higher costs.
Absolutely. Brian, did you have a question?
Well, I just wanted to go where Bob went. You know, that's what the supervisors that are here now, and we've lost a lot of our elderly people that were here when Bob and I started. We're the 2 old guys now as far as experience goes. And some of these things take years to conquer. It's not like you can do it in overnight. And that's the bigger issue in his life, why our supervisors all need to be up to speed on what is really going on, because sometimes we can predict where things are going just from the way they've used us in the past. And Bob's brought up these unfunded mandates since the beginning of time. I remember the first day I met Bob here on the floor, he was going on about unfunded mandates. And they just keep going and going. And if he doesn't keep bringing it up, we forget how we got there, and then things fall by the wayside. And this is kind of how we have to keep after them, and we have to get more people, more supervisors involved. And hopefully over the next few months, especially if we can get back to in-person and get beyond this COVID thing, we can all be in person and have those kind of conversations that are important for the future of our county and in the whole state for that matter. But thanks for bringing that up, and Rob for reminding us of where it's come from and where it's gone and probably where it's going. I mean, those are the big issues right now, and we just have to stay on top of them.
Any other thoughts on this? Okay, are we ready to adjourn?
Do it.
Adjourned.